Why is fever a common epilepsy seizure trigger? Fever can seem like a simple sign of illness, but for some people with epilepsy, it can be a trigger for seizures. This is because fever affects the brain in ways that make seizures more likely. When you have a fever, your body temperature rises, and this change can directly influence the brain's nerve cells, called neurons. Higher temperatures make these neurons more excitable, meaning they are more prone to firing electrical signals uncontrollably. This increased activity can lower the seizure threshold, which is the point at which a seizure can occur, making it easier for seizures to happen. Fever also activates the immune system to fight infection. During this process, the body releases chemicals called cytokines, such as interleukin-1 beta. These chemicals are helpful in fighting illness, but they can also influence the brain. Some cytokines can increase neuronal excitability, further raising the risk of seizure activity. This means that the immune response to a fever can add to the brain's vulnerability during illness. Children are especially vulnerable to fever-related seizures because their brains are still developing. This is why febrile seizures are most common in children between 6 months and 5 years old. These seizures are usually brief and not harmful, but they highlight how sensitive a young child's brain can be to temperature changes. Adults with epilepsy can also experience seizures triggered by fever, especially if they already have a lower seizure threshold, which means their brains are more prone to seizures even without a fever. Fever often occurs alongside infections, which can cause dehydration, electrolyte imbalances, and physical stress. These factors can also increase seizure risk. For example, dehydration and electrolyte disturbances can disrupt normal nerve signaling, making seizures more likely. The combination of increased brain temperature, immune chemicals, and physiological stress creates a perfect storm that can trigger seizures in susceptible individuals. Managing fever promptly is an important part of living well with epilepsy. Using fever-reducing medications, staying well hydrated, and monitoring symptoms can help lower the risk of seizure episodes. It's also helpful to work with a healthcare provider to develop a personalized plan for managing fever and other triggers. Remember, not everyone with epilepsy will have seizures when they have a fever. Each person's sensitivity varies, so understanding your own triggers and working with your healthcare team can make a big difference in controlling seizures and maintaining quality of life.